Hello to all students. In this video lecture, we are going to discuss asthma. Asthma is a serious lung disease which do not have any cure, but it can be preventable and treatable. So what is asthma? So first of all, to understand the basic concept of asthma, we have to look at the anatomy of the lungs. There are two pair of lungs present in the chest cavity, right lung and left lung. Air from our nostrils enter into pharynx, pharynx leads into larynx, larynx leads into a pipe-like structure, trachea, which is also known as windpipe, which bifurcates and divides into bronchi going into each lungs. Each divides and subdivides into bronchioles, which leads into alveoli, which are small sac-like structure present inside the lungs, where gaseous exchange takes place between the blood and the lungs. This is the normal alveoli and the bronchiole of the lungs. Air passageway is clear. There is a wide opening and small amount of mucus is present. But when there is an attack of asthma, these air passageways constrict and they become like this one, asthmatic, and they become narrower. So there will be a difficulty in breathing. So that is what asthma is. So by definition, asthma is a severe paroxysm of difficult breathing due to the constriction of the air passageway present in the lungs due to any reason. After that paroxysm, there is a period of complete relief which can be taken by medication or by precautions. Then there is a recurrence of attack at shorter and longer period of time. So asthma never goes away. It has to be maintained, it has to be treated, it has to be judged every day. So what are the symptoms of asthma? So first of all, we are going to look at the main symptoms of asthma. The first symptom is shortness of breath. It's very hard to take breath in. There is a chest tightness as somebody is puts a heavy weight on your chest. Wheezing, the sounds of whistling when heard with stethoscope and sometimes with the normal ears. Coughing, sputum production, which is usually followed by infection, and sputum is produced inside the lungs, blocking the air passageways. Airway blockage, inflammation, these are all the main symptoms of the asthma. Depending upon the cause of asthma, there are different types of asthma. Number one, there is acute asthma, in which a severe attack, a severe paroxysm causes the shortness of breath. Then there is a chronic asthma which runs for many years or sometimes for whole life. There is a childhood asthma which starts at the birth of the child. There is adult onset asthma which starts when a person gets at the age of an adult. Exercise induced asthma, which is produced as a doing heavy exercise. Allergic asthma, which is due to allergic reaction. Sometimes there are different types of allergen present in our environment which can cause asthma. Occupational asthma, different occupations like welding, like working in a factory or such plants which has some pollution, some chemicals, that can also cause some types of asthma. Eosinophilic asthma is usually caused by bacterial infection. This bacterial infection produce sputum, mucus, too much mucus inside the lungs, and the constriction of the airways which are filled with by excessive mucus and block the air passageways and causing the asthma. Nocturnal asthma usually occurs at the night. Aspirin induced in asthma is usually caused by taking aspirin, and cough variant asthma is usually such asthma which does not include air passageway blockage, rather it causes severe coughing for a long period of time. So what are the causes of asthma? There are different causes of asthma which include infections, infection of air passageway like cold, flu, sinusitis, rhinitis, bronchitis, and different types of infections of the air passageway which can produce such symptoms which leads to asthma. Allergens Allergens are such chemicals which cause allergies in some people like perfumes, pollens, dust, mold, and mites, etc. So there are many different types of allergen present in our environment, and different people tend to have allergy from different types of chemical. So what is an allergy? Allergy is a reaction from any substance which is harmless to a normal person. For example, if you are standing on the side of a road, so there is a smoke, there is a dust, there are pollens everywhere. There are two types of people. One, they do not have any kind of problem with these pollutants and allergens, while the other person which is very sensitive, have a genetic predisposition. Whenever an allergen or a pollutant enters into the nostrils and the air passageway of the lungs, their lungs their blood produced a specialized chemical known as histamines, which produce allergic reactions, and due to the allergic reaction the air passageways of the lung become like this one, constrict, and when air passageway constricts, there is a paroxysm of difficult breathing, so that is producing a kind of symptoms of asthma. So patient has to be careful about those pollutants and allergens. Genetic predisposition is also main cause of asthma, and pollutants present in our atmosphere. As you know that nowadays air quality index is very low, and there is a lot of smoke, lot of smog, lot of pollutants in our environment which are causing different kinds of asthma. So how do we know we have asthma? So first of all, we can judge by symptoms. The other way to judge the asthma is a specialized instrument which you can find from any medical store or pharmacy, which is known as peak flow meter. So peak flow meter is just like this one. It has a mouthpiece and it has a scale. So first of all, you are going to inhale air in your lungs, and then you put your mouth on this mouthpiece just like this one, and exhale the air into this peak flow meter. The scale present in the center will rise up. If this rises up to a normal value, then your breathing is okay. But if the scale remains below the average level, where the red sign is, then you are having a difficulty in breathing. So that's how you can measure the symptoms of asthma. And you can also judge by using stethoscope, by placing stethoscope on your chest or on your back to listen the whistling sounds of the lungs, which is also very important symptoms of the lungs. So once a person has an asthma, so there is no cure. So we have to treat asthma and to maintain its normal level. So how do we do that? We do different types of medication, we do different types of exercises and methods. So first of all, I will recommend prevention. Prevention is better than cure. If you have allergic asthma due to any pollens, dust, so you must avoid those pollens and dust. But we cannot prevent, or we cannot take precautionary measures all the time. So sometimes we have to suffer from these symptoms. So anyhow, there are different types of treatments available. Number one, inhaled corticosteroids, which are inhaled in the form of inhalers. So there are different types of inhalers present in the market. There are powder inhaler and liquid inhaler, aerosol inhalers, which can be used to deal with the attack of the asthma. Beclomethasone, budesonide, fluticasone. So these are different salts available in different countries and at the with different brands names, but you must see a doctor before using any kind of medication because it is very dangerous. The second type of treatment is usually leukotriene modifiers, which are used to prevent lungs from constriction again and again. These type of medication are taken daily, 10 milligram dose every day, so that a long-term chronic asthma can be prevented. In this include montelukast sodium and Zephyr-Locust, which can also be used at regular intervals every day to prevent the asthma attack. Bronchodilators, which dilates the bronchioles which have been blocked by constriction, inflammation in the lungs. These are formoterol, salmeterol, which can be used in the form of inhalers and as a nebulizer, so to open the air passageways of the lungs. Anticholinergics in this include ipratropium and tiotropium. These are also administered with the help of nebulizing machine or inhaler to open the air passageways. In the severe case of asthma attack, intravenous or oral corticosteroids can also be used to deal with the paroxysm or severe attack of the asthma. There are also certain other medications are also available, but you have to consult with your physician. So there are also alternate treatments are available, like natural medications, homeopathic medications, and some kind of syrups which can also help to open your lungs. So there are very two important medications in homeopathic treatment: arsenic album in the 30 and epicoc 30, 5 drops on the tongues until the disappearance of the symptoms of asthma. You can use these two medications to deal with the attack of the asthma. That's all for today. I hope it makes sense, and I'll see you in the next lecture. Until then, bye.